I want to welcome everybody to the World Autism Summit 2024. We're really excited to be back this year, and we have a very special guest with us today. And if we were in Greece, we'd call him Dr. Meletis. But since he told me he got called names with that in America and North America, but since we're a global conference, it can be whatever you want. Dr. Meletis or Dr. Chris. So Dr. Chris, thank you so much for joining us today. I really appreciate having you here and love the colorful image you have of my brain.
Actually, I felt it was quite appropriate for the topic of the diversity of the brain. So in all the different areas of the brain. And it's amazing. I just learned this about 2 or 3 weeks ago. I have a new statistic. There's 100,000 miles, yes, miles, of blood vessels in the brain alone.
Holy.
And I was like, wow. It's like the more I continue to learn about the human body, I've been a doctor for 33 years, I'm finishing my 19th book with Dr. Alan Kadish, which will be also a speaker. And we're talking about fertility and healthy fertility and so forth. But the more I research, the more I find out, and the more I'm back to my childhood of being in awe. Just like when we first saw a butterfly, we first saw a hummingbird, we saw a dragonfly, or a sunflower. In fact, right outside my window, I planted these little baby sunflowers at the very 1st of July, and they're now 12 feet tall and higher than my little ranch house. Wow. They're looking over my roof, and it's really, really cool. So I think we have to keep the awe, the childhood mystery, and continue using that curiosity to help on topics like autism. Like, I wonder if, and I wonder how, and we know the statistics. Everybody in the audience, unfortunately, knows the statistics. Back 30 years ago, it was about 1 in 500 individuals would experience an autism experience. Now it's 1 in 36 per the governmental website. It's like, So we'll talk about all those things today.
That is so fantastic. Well, you know how autism got its name, right? Because of all the awe, right?
Ah.
So I would love for you to share with our listeners today about this magnificent brain that we have. And I think there's a lot of controversy about mental health right now. So you're perfect timing for this conference.
Oh, no, sir.
Okay. So I was going to ask you about dietary concerns. Like, do you have any information about diet and nutrition? And just as a matter of fact, you may.
Well, no, certainly. And I often like to give the example of I'm a 70s kid. I was born in the 60s, but I watched 70s Saturday morning cartoons. And we learn lots of things. I'm just a bill on Capitol Hill, conjunction, junction, what's your function? And we are what we eat. Yes. And many of us have seen pictures of the fast food body with all the little hamburgers and Cheetos and Doritos and soda pops. And then we see a healthy, pristine body. But we were all at one point in time, mom and dad got together and we were a speck. Didn't weigh a whole lot as a speck. And then we were born somewhere between 5 and 11, 12 pounds, depending on whether your mom has gestational diabetes or you come from a very large stock. But then we are clearly more than that initial birth weight. And we're building our body. And on my last slide, we'll really take it home with the 3 little pigs, or we build our house of straw, sticks, or bricks. What's really important to discuss here is autism is no one's fault. It happens. It's something which we deal with. My office manager, her daughter is in her 30s and has autism. I have multiple patients with autism. So there's no fault here. But now when we have the concept and the challenge in front of us, we need to figure out how to deal with it. And so Thomas Edison was quoted for many things. And the chief function of the body is to carry around the brain. True. And as we're all sitting here, our brain requires 20% of our oxygen and 20% of our energy. Yet it only weighs about 2 to 3% of our body weight. So that's going to be a crux of our conversation is what are we doing to fuel ourselves? And just like there's different kinds of cars, there's EV cars, there's 4-cylinder cars, there's fancier cars, there's race cars, and there's go to a gas station, you can have a diesel, you can have 87 octane, 89 octane, or 92 octane, or even fancier. And so each of us need to be fueled individually. And that's the key. And the biggest challenge is each individual comes to the autism experience in their unique way. Some of it's genetics, and mom and dad got together, and my wife and I routinely talk. If we knew our genetic profile and we were dating, like, oh, here's my genes and here's my genes, which 35 years ago we didn't know anything about genes. Like, I wonder how those two would mix, and what would we do ahead of time to make sure they mixed better, and that we mitigated certain things. And that's where genetics testing comes in for things like MTHF and so forth. But what's intriguing is there's a lot of medical literature backing up what the autism community is talking about. It's like, hey, well, what about the gut? Well, there's literature about the gut, and that there is a relationship between an altered gut and autism. And you say, but I thought we were going to talk about diet. Well, once again, I'm built to, I would argue, I'm overbuilt these days, haven't sat for too many years. And it's like, well, when I eat, doesn't my microbiome eat as well? The answer is yes. Like little fledgling birds, little Pac-Men and women, you go ahead and you feed the microbiome. So even honestly, I would argue that when you and I eat, our microbiome is probably eating before it even hits our intestinal lining for us to absorb it. And so I think that's important. And I have a patient over the years that's in New Mexico, and she ended up with a terrible GI disease. It's called C. diff. It's an infection that occurs after antibiotics. And so she qualified for a fecal transplant. So she went to Mayo Clinic, got a fecal transplant, and the mom reported, like, wow, she is doing so much better. I haven't seen this part of my daughter. And this is, once again, a young woman at the time in her late 20s, but she had a fecal transplant. Her behavior changed, her aptitude changed, her personality became much more robust and engaged, all with the fecal transplant. So we all hear the terms leaky gut, leaky brain, and well, there's a definitely a connection there. But sadly, she started losing the benefits of that fecal transplant because she did not change the diet. We know with autism, and for me and everyone else, we have our favorite foods. Well, her favorite foods included McDonald's and French fries. So this new friendly bacteria, which was from a neurotypical individual, started being fed unhealthy food, and she started slipping and losing a lot of those neurological gains of the fecal transplant, which I thought was kind of interesting in a sad, sad way. And so it's kind of, once again, that takes home to the fact is that's why the microbiome is so important. And we're going to talk about the mitochondria today, but we're feeding not just us, but there's actually more cells in our GI tract in terms of bacteria and other microbes than there are cells in our entire body. I think when they vote very strongly. And as a result, we end up with challenges. And you mentioned all the mental health challenges we have. Clearly, the COVID era was not friendly to any of us. It was stressful. We got isolated. We got in conflicts with friends and family. And anxiety and depression are very prevalent. And during that same period of time, autism continued to grow even more prevalent. All very sad, all very scary. So then there's a concept of, well, what about our cerebellum? Most of us think frontal cortex. You and I are right now using primarily our frontal cortex. So we think. But our rote memory, and you think rote memory, you think, of course, multiplication tables, 2 times 2, 4 times 4, 13 times 13, all these different things that we have memories. Well, our cerebral cortex really plays an exceptional role in not only autism, but Parkinson's and depression. It is 70% plus of all the brain neurons are in a walnut, in the back of our brain. And we always think, oh, that's very cerebral of you, Chris. Well, yeah, let's give some credit to the cerebellum. And a lot of the repetitive actions, the rocking, are self-stim, and we all hear that term, but they're really trying to engage the cerebellum. There's other ways to do that. We'll chat about that. And then the concept of different sensory components. And once again, we're feeding our neurological system, remembering 20% of my oxygen goes to my brain, and we'll talk about that relative to apnea, but 20% of all the energy is required. So what are we doing to fuel our brain? And lastly, we'll talk about some gluten, some autism, and the research on gluten and autism is remarkable. And so you're like, oh yeah, the hardest ones of all, Chris, gluten. And it's like, it is. And so on that note, and I'm going to finish this one up because I, as you remember from my last chat with you, boy, I have a gift to gab. But what's interesting with the autism and the gluten, these are all things that we don't think about, but think about also Roundup. Well, what do? They put a lot of Roundup glyphosate on our grains. And for my patients that travel to Europe, they're gluten-free. They go over there and they can't pass up the French or Italian bakery. And also they say, I ate gluten or I felt fine. The moment I came back and had the same thing, I had the same little, a similar bakery that was ethnic, I messed up here in the United States. There's something going on. And I think the fact that there's so much more autism in the westernized world, I'm not saying Europe's not westernized, but they have different regulations. I think that's important to kind of ponder. And then mom comes into play and maternal influences over offspring allergies. Like what? So the research shows that the development of increased risk for allergies in offspring of allergic of moms that are allergic occur in utero. So while baby's on board, or quote unquote, the bun in the oven. And so the development of allergies and distinct dendritic subsets occurs in allergic moms. And this particular article, I'm not proposing this, but they're saying, hey, take some alpha tocopherol. And I would argue D-alpha, not D-L-alpha. Always think of the L for loser. So you want to take some alpha tocopherol. But more importantly, we know in the autism community that if a mom has allergies, the risk of child having non-neurotypicalness increases a little bit. We also know that if a mom takes acetaminophen, there's actually a link there. And that one's very interesting. So of course, according to the standard, mom has a cold, a fever, whatever, while pregnant. Well, here's some acetaminophen. It's approved for pregnancy. We now know that acetaminophen alters the endocannabinoid system. Think hemp, CBD, and our natural anandamide, which is bliss. And anandamide means, in Sanskrit, means bliss. And so the acetaminophen is messing up with the endocannabinoid system. And I think that's one reason that some people do better with CBD when they're having the autism experience. So I think that's kind of intriguing to say the least.
Yes.
And I'm sorry for just doing a monologue here, but I think last time we were saying avoid so we got the gluten thing, we've got something else which we're going to chat about, but then we have the histamine foods. And histamine foods can cause fatigue and dizziness. We all know, and I know this well, ask my wife, the term hangry, hungry, angry. So any child or adult that doesn't get enough sleep and doesn't eat properly, they're not going to function in their brain. But then there's histamine foods, which further cause problem. And here's a list of these which come to play. And this little handout, which I've created for my patients, that you're welcome to have as an audience to actually do, like I'm going to play around with some of these foods. Like, but I thought spinach was good for you. Well, first off, let's look at spinach. Spinach is on the Dirty Dozen Foods from the Environmental Working Group, EWG.org, the Environmental Working Group. Spinach is as bad as strawberries when it comes to being herbicide and pesticide. But I'm just trying to be healthy, like Popeye the Sailor Man, which of course back to my dating myself in the cartoons I watched. And it's like, So the Dirty Dozen Foods makes a list of the 12 foods you should not eat unless you can buy them organic. If not, just don't buy them. And everything's so expensive these days. So it'd be like, okay. And same thing with strawberries. And then there's a 15 clean foods. So the Environmental Working Group every year says these 15 foods, even if they're not organic, probably are okay. But these Dirty Dozen foods they're Dirty Dozen and don't consume them. So once again, the three little pigs, are we building of straw, sticks, or bricks? Because sadly enough, I think the statistic of 1 in 36 now on the governmental websites for autism is a reflection of the big bad wolf. The big bad wolf is here, and the big bad wolf is blowing against our houses and our loved ones, and we need to figure it out. And my last slide on the nutrition question, which you asked, is sadly enough, we're going to pick on gluten, and we're going to talk also about certain foods. This is a peer-reviewed journal article. So once again, this is from the scientist saying, including gluten-free and casein-free ketogenic diet or specific carbohydrate diet. So I usually go gluten and casein-free to start with, and I'll add other things. But probiotics, they're friendly bacteria, because remembering that we make 70 to 80% of our serotonin, a brain chemical, think Paxil, Prozac, Zoloft, Celexa, well, the SSRIs, but our gut makes more serotonin than our brain. Dopamine, which is contentment, it's also perseveration, and happiness. It's also 60% in the brain. Our omega-3 fatty acids, dietary supplements, A, C, B6, and B12, magnesium, and folate. Those are all just no-brainer supplements, with the exception of vitamin A. Vitamin A is one of the most toxic substances you can take. So if a child measures low in vitamin A, it's a great supplement. Otherwise, vitamin A is not one you just give willy-nilly because it can have toxic effects. And the other ones are much more tolerated. And they listed here on the little chart, folic acid. You and I both know that's a huge misnomer. It needs to be the methylene tetrahydrofolate. The audience could probably see I have a fairly large head. And even when I was thin, I had a fairly large head. And I remember Lily in high school said, well, your face is really normal, but your head's really big. Well, that's because I have the genetic mutation for MTHFR called 677T, and I have hydrocephalus. I have extra fluid in my brain my entire life. So I have a very large head. And it's like, So once again, they used to tell in prenatal medicine, here, take this vitamin, and it had folic acid in it. But many of us in the audience, our kids, have methylene tetrahydrofolate, so they can't convert to the active form in the body. So you want to have that in your prenatal and your daily supplement, and also for our kiddos. But as you can see here with gluten and casein, and it affects the opioid receptors. And that means us adults, even if we're quote unquote neurotypical, whatever that means. And so it's like gluten and casein, and look at affects opioid receptors in the intestines, crosses the blood-brain barrier here, and look at here, autistic behaviors, and kind of intriguing. And lastly, gut brain motility, very important, making sure our kids are pooping 2 to 3 times a day, because we can't talk about food until we talk about how it processes it through us. And I always describe it this way. You want your poo to look like a Costco hot dog. And I'm not picking on Costco, but you want it smooth, long, not wet and slimy. You don't want it hard and lumpy and bumpy. And I always ask my patients, tell to me about your bowel movements. And one of them said, hey, I have very regular bowel movements, because my intake form asked, bowel movements, regular. I said, well, tell me more, because I'm a naturopathic physician. And he said, well, about every week and a half to 2 weeks, I have a bowel movement. Okay, I guess like clockwork, you have a bowel movement. But I asked the question, if you have harder, drier bowels, what happens to all that moisture? And what I call muddy water, to be polite. And we're like, no wonder you feel poopy. So once again, making sure we got rid of those toxins. And many individuals have heavy metal burdens, plastic burdens, paraben, phthalate burdens, which I'm sure Dr. Kadish, my collaborator on our fertility book, will speak about it. We're going to be giving away several free books to the first people that ask for the free book, because we speak about healthy pregnancies, but it also talks about retroactively what can I do once we're in the need of some more attention. And then once again, detoxification as well. So I have gabbed away. Feel free to redirect me.
Oh, that's fine. I just love hearing everything you have to say, except it's going to totally change my diet. So
well, don't hate me for that, Karen.
oh.
Free, casein free, histamine free. Oh no.
Know.
I remember Chris's interview. I've never been the same since.
Now? What do I eat? Anyway, I wanted to find out about exercises that can help integrate and maximize processing, the combined process of what fires together, wires together, the interplay between the cerebellum and cerebral cortex.
Certainly.
Mouthful.
So this would be a good time for me to share a story.
Okay.
So when I was born in 1965, they were certain I was, at the time, the term was used very politically incorrect now, retarded. I was uncoordinated. I was born with this very large head. And I repeated the 4th grade because I couldn't figure out the integration between reading, writing, grammatical stuff. And then the story goes on that I was eventually tested through the normal state testing systems in 7th and 8th grade. Before that, I was always considered special in a special way. And then they said, well, Chris, you tested exceptionally high, the highest in our school district. And this is not about me, it's just about what genetics led. And they moved me from the most remedial classes to talented and gifted. But I had owned that label of being broken and subpar. And then I was told, no, 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 you're going to have to like, I didn't even know what talent gift it was. I was just kind of plodding along, doing the bare minimum, very bored, not academically challenged. And so lo and behold, through all some speech therapy, some athletics, and this is where the training comes in. I was gifted to have a wonderful teacher, Miss Lyons. I gave this little description to the Portland Public Head Start Committee, which I sat as a volunteer for over a decade. I was describing my experience and Ms. Lyons. They said, Ms. Lyons? Oh yeah, Ms. Lyons now has Alzheimer's and so forth, but we know her very well because she was known for taking and nurturing kids. But one of the things, they had me dribble with my left hand, they had me dribble with my right hand, they had me do all these exercises, which back then was integrated in my cerebellum and my cerebral cortex. And once again, we can carry about 7 thoughts in the front of our head. And so welcome to the 7-digit telephone numbers. And they're there for a short period of time, and then all of a sudden they're gone. So we've talked about food, and we've talked about food as your medicine. That's Hippocrates. And being a good Greek as I am, I can always quote Hippocrates. And then it says, but then we go to the Roman. What is food for one is bitter for the other. So Lucreticus. So that's kind of finish up our food side of things. And then we go to all disease begins in the gut. Well, I was just speaking about when our gut eats, we eat, but our little microbes do too. And when we have a little burp or a little toot, guess what's doing that? The vast majority of that's our bacteria because we're compost piles. And then truth kindles light for truth. Lucreticus, back to the Roman. So with that, the neuroplasticity. Right now, we have nerves that are dying. We have nerves that are growing. We lose about 86,000 brain cells a day. But thanks to neuroplasticity, we have the ability to recreate them. And literally in our body right now, this is what's happening. And this animated thing, it's like, it's going like this, it's going like this, going like this. Like, wow. But that cerebellum, that walnut-sized shape, has 70% of our neurons. So why don't we employ that and work that? So it's used for attention deficit. It's worked for athleticism. So let's say you're actually just trying to become a better golfer or a better basketball player. You can actually work your cerebellum to improve on that. It's part of the drills that they do that. But there's also applications on either a phone, a tablet, computer that allows you to do that as well. So the key here is that we all have sensory strengths and weaknesses. And so the question is, how do we strengthen our strengths and then really enhance and augment our weaknesses? And we do that through this little walnut-shaped size here. And so that's an important part that we often forget. And skilled, gifted people along the way have always noticed that there might be a gait issue. They're not walking as straight. They might have a coordination issue. They might be self-stimming one way or the other. That's all cerebellar stim. The individuals are trying to stimulate themselves. But now we're going to give them a structured program to do that. And that structured program is called Zing. Now, mind you, if you have a good physical therapist or chiropractic neurologist, you might have them, the chiropractic neurologist might have you go like this. They might do different things. There's a doctor here in Lake Oswego named Glenn Zielinski. And after I was a dean at the Naturopathic University for 70 years, the oldest naturopathic university in North America, I actually started being the medical director of a very integrated practice. And Dr. Zielinski, Glenn Zielinski, worked there with me. And he did a neurological evaluation. He noticed still as an adult, even though I've been a dean, I've written lots of books, I disowned, thanks to Ms. Lyons, the label on being special in a special way. But he knows that when I walk, my arms don't go in coordination like normal people, whatever normal people are again. And I still have some deficits in terms of my integration of my brain. And I have a wonderful patient. Her name is Jeannie. She's in her 80s. And she, in her late 60s, had to learn to recrawl. She had skipped the crawling pattern. So lots of times in 60s and earlier, you'd be put in a little walker or bouncy chair that you skipped. You were still not in, you're either in crawling phase or you're just getting put there as a, babysitter to, keep you out of trouble. And so we didn't integrate properly. We had to crawl on all 4 first. before you walk. But if all of a sudden you put in a walker before you've mastered crawling, you've done the layers wrong. It's like, it's not supposed to be this hard. And having kids and having lost one in between, that's one reason I write fertility books, is because I want people to be able to have children that want to love their children and nurture them. And then I want to have them have healthy pregnancy outcomes. So Dr. Kadish, in my book that we're offering for free to most of the audience, will be, once again, important on that topic. But the Zing Performance Program, which I have zero ownership on, but I actually have had patients use it for attention deficit, with autism. Generally, the age to start this, because of the needed attention, is 7 years of age. And there's simple little programs. I've done it. I also realized we're doing it that I was really out of shape. It says, jump on your right foot so many times, jump on your left foot. I'm like, I'm out of breath and my knee hurts. But once again, if you're a kid or youthful or not as old and decrepit as I am, and so then the CEO of the company, a wonderful fellow, John McGuire, that runs Vitalio and also Zing Performance, he said, let me give you the senior version. I said, okay, I'll do the senior version. So, and once again, it was the same work. So there's a little bit of modification and there's personal coaching along the way, but it helps with the child's excelling on whatever skill they're weak in, helps with sensitivities, food, clothing, hidden challenges. And of course, we know all about with autism experience that certain taste, flavors, textures, and there's also a version of this for us adults, kids too, but for us adults, for PTSD, for anxiety, depression, and trauma, because once again, we include a lot of things. We somatize them, we put them in our body. We also put them in the recesses of our brain, including our cerebellum. And so we can work our ways out of it. And I give the example of a fine little necklace. In fact, the other day we were out eating with our now 26 and 30-year-old sons, and they pointed out my wife's very single knotted gold necklace, which was super thin, like maybe a third of a piece of yarn was knotted. They tried one, the other one tried not. Old man Chris here finessed it, massaged it, loosened it, undid it. But that's really what we're doing here, is we're trying to massage the different parts of our stuckness, and that little knot represents our stuckness. And it takes some finesse. And as parents and loved ones and educators on this call know, it's not easy. If it's easy, then we want to have our problems. But working on the feeding, fueling, and all this is vitally important.
Wow. I do that a lot in my jewelry store, like when people knot their chains up and stuff. Yeah, so I can relate to that.
So as we segue probably to your next question for me, yeah. I think of Alexander the Great. And for those that love history, Alexander the Great was challenged with the Gordian knot. And we as parents, as teachers, as healthcare providers, as just people that love everyone, we know that we have to figure out the Gordian knot. And the Gordian knot was the unsolvable knot of ancient times. In fact, they said, whoever can solve the Gordian knot will become the ruler of our kingdom. Wow. So Alexander the Great, looking at it, went ahead, took his sword, chopped the knot, says the problem solved. And so maybe all together as a collective, we will chop through the knot of autism and liberate and allow people to expand and not have the challenges that they often do in today's world.
That's beautiful. I love that. That's a good analogy, and I can sure relate to that. What I'd like to know is dietary supplements that are foundational for neurological performance. Can you think of some that are really good? I'm sure you've got some up your sleeve.
Yeah, so certainly. So I think the key ones for all of us is, and whether a person was successful in breastfeeding or not, we know that with baby formulas, they put something in the baby formulas. And what is it? They put in DHA. And DHA is one of those omega fatty acids. And so lots of times, once again, I'm an avid gardener. In fact, I just moved into my current little ranch home, and I just created about 50 linear feet of raised garden beds. 3 feet wide, and digging up the clay and adding the organic soil and all of this. But we're really creating an environment. And so I do a lot of testing of patients, and there's a resource I'll share at the end, which hopefully your healthcare provider will do an essential fatty acid test for your kids, but also for you as well, all of us, because most of us are omega-6 rich, and we have too much arachidonic acid, which is pro-inflammatory. But why did I pay the money to have organic soil for my garden? Because I could have just used whatever soil was left after they scraped all the way down to the clay. It's because I knew that whatever I plant in that environment will be what I consume. So likewise, because there's no such thing that I'm aware of as an organic human. You buy all kinds of other organic things, but not an organic human. And so it's because we live in a toxic house. We have Wi-Fi. We have municipal water with chlorine and sometimes fluoride, which I don't want to go there, but I'm not pro-fluoride when it comes to brain development. And it's like, So I spent the effort to make my environment as organic as possible. I can't control the wind and the rain and the airborne pollution, but I can control the soil. But now we think of our bodies as the soil in which, either from the male contribution, is he bringing the best genetic potential that he has? And is mom able to incubate to the best of her ability? And the answer is, yeah, everybody's doing it to the best of their ability. There's no question about that. But moms received, and dads too, received toxins through the placenta from their moms. And it becomes this generational domino effect. In fact, they've shown on Alzheimer's, and I often will speak about the 3 A's: Alzheimer's, autism, and attention deficit. And it's like, okay, well, with Alzheimer's, they find that individuals in my age category and older still have DDE in their brain. And DDE, what's DDE? It's a metabolite of DDT. But DDT, which we remember was hurting the eagles and so forth, and the birds back, was banned in 1972, but it's still in our environment. So we're just bioaccumulating all these toxins and pollutants. Then we have the additives and the chemicals and the foodstuffs. I mean foodstuffs. And all these things are just bioaccumulated. It's not our fault. But once again, if I put sunscreen on, sadly enough, I have to look to say, does it have paraben? If I'm drinking out of a bottle, does it have phthalates? Does it have, and it's like, so all these things have accumulated. And so there's certain things that Alan Kadish and I in our fertility book, which we're going to be offering for free to most of the audience, the first few hundred that come, we're talking about these sort of things you can do, like heavy metal testing. Because first thing I would do is I mention essential fatty acid. Well, maybe I should eat more fish. Well, right after, there's no such thing as organic ocean or organic human. There's no such thing as an organic ocean. So which organic ocean am I going to be able to harvest that fish? So you can go for algae and so forth, but you want to really dial it into optimal levels. And I'm a big believer of we have to, once again, test and not guess. So looking for the heavy metals, looking for the essential fatty acids, making sure the B12 and the folate's there. And so on that note, B12, it's a no-brainer. Folate, no-brainer. And when I say no-brainer, no pun intended on autism in the brain. But autism is so much more than the brain. It's also the gut. It's all of our cells. And then I think the other big thing which we often forget is that we have to have the foundational antioxidants to detoxify. We have to have the fiber, because our friendly bacteria in our GI tract, they actually nibble on fiber. And I'm going to use this term loosely, non-scientifically. They poop out short chain fatty acids. And like, short chain fatty acids, what do you mean they poop them out? Well, when friendly bacteria eat fiber in our diet, and how many people eat enough fiber? Not most of us, because remember, mom or dad or grandma said, eat your 5 to 7 servings of fresh fruits and vegetables, okay? And once again, we eat so many processed things that are devoid of fiber. And so the butyrate that is made, which is a short chain fatty acid that's made from this process of eating healthy, actually crosses over the intestinal lining. And we have something called tight junctions. And the butyrate crosses over the single layer of cells. So yes, we have a single layer of cells in our intestinal tract, our colon. And then it's doors wide open. It's like enter the immune system. Let's cause neurological problems. Let's cause fogginess. And we've all experienced it. We've ate the wrong food, we're getting alcohol. And we were like, I don't feel so well. And that's because we get that toxic effect. And our bodies are much like the scanner at a store. And sadly enough, here in Oregon, and representing Oregon here with my Oregon coffee mug, is we have self-checkout. You go to the grocery store tomorrow, I'm doing the work. I'm not sure how it is where you live, but it's like, what in the world? I used to go to the store. I was kind of tired of going in a big old shopping cart, which is now 3 times more expensive. I'm making that number up, but it feels like 3 times more expensive. And now I have to unpack my cart, put them in bags, put it back, and I do all the checking. But what I give as an example is on, let me see if I can find a good picture here, a good example here. Here's a probiotic, not going to promote it, but it has a barcode.
Mm-hmm.
And that barcode, he says, I am this kind of probiotic. And this is part of my daily regime. I got my CoQ10, I got my Uterate to augment my diet. And we know things like ghee and clarified butter has a lot of butyric acid. And what do they give children that are born with microcephaly and small heads? They give them a lot of butter. Because once again, gut, brain, they knew this 30 years ago. And once again, we're not eating sufficiently. But back to the scanner. So my immune system is a scanner. The barcodes represent foods, friend or foe. And so now the scanner is saying, not me. I don't like to look at that. And I trigger inflammation, and brain inflammation plays a role. So this little one, which is just a clip art, but it's like, well, if he's not slept well, he hasn't ate well, he has eaten a food sensitivity or a histamine food, then all of a sudden, of course, he's not going to be fully engaged. Might have been you just taking away his hot wheel and you say, it's time to do math. And then, of course, welcome to it. All of us get perturbed when we get our favorite thing taken away. Yeah. So the other big thing is when I talk about diet and nutrition, I speak about the prime directive that we were never taught in school, oxygen. So you and I can live a few days without water, put us in a desert, pull us off life support, and we're going to dehydrate ourselves to oblivion. We can live, sadly enough, we know from the bad behavior of human beings to other human beings, we can live weeks and months without food. But how long can we live without air? Moments.
Yeah.
And lots of kids will have, and I'm not saying all children, but sleep apnea is huge. Once again, sometimes muscle tone and once again, very individual experience. But check for adenoids. Are they nasally? Are they talking as though they're from Boston? And I'm nothing from against Boston, but I had a young boy that had, sadly enough, cystic fibrosis, and he was always very nasally. And we didn't know he had cystic fibrosis at the time until we did some other testing because it had been missed. And so nasally is not a good thing. The other thing is, hey, how are those tonsils? One of my sons actually had kissing tonsils. And the doctor said, oh, he hasn't had enough strep throat. And I'm not a big proponent of chopping body parts out. But lo and behold, I said, well, but he's turning blue at night. Literally, he was ashen blue. And so I went ahead and said, well, I mean, he hasn't hit the criteria for insurance to pay for a tonsillectomy. But how about him turning blue? Is that kind of a criteria? Maybe? Question mark. And yeah, I would argue. And so he wasn't doing well. He was a skinny little boy at the time, one of my sons. He gained 10 pounds in 1 month. He also was not doing well in school. In fact, they were going to keep him back in elementary school because he wouldn't even follow the directions, and he would actually throw away his lunch. Oh. Why was he throwing away his lunch? Because he couldn't get the food past his tonsils. Wow. So he wasn't sleeping well. He wasn't eating well. He was malnourished. So obstructive apnea is very common in lots of kids. And they looked here in the early developmental phase. And any of us that were mouth breathers, I was a mouth breather, it changed for the rest of my life because it wasn't addressed at the time. My mom did a lot of good things for me, but that was not in a knowledge base. I was a mouth breather. I got my allergy shots. I had asthma medicine, so forth and so on. But my hard palate has changed. My facial structure has changed, all for having been a mouth breather. Wow. So getting a home sleep apnea test, and you're, as parents, or people that are dealing with autism, or just kids in general, like, I'm not going to send my kid off. And you know how that's going to go to a sleep medicine clinic to get tested? Yeah, right. If you just get him to sleep at night is hard enough. And so this, of course, is very interesting. Journal of Clinical Sleep Medicine showing that there's a big link there. The other thing which I want to talk about is the fact that when we're feeding and fueling our body, our proteins at the top, our carbohydrates at the top, fats at the top, it actually goes down to feed our little purple, what I call washing machine, citric acid Krebs cycle. But look at all the nutrients necessary. I eat some carbohydrates, and then I need my B vitamins. Well, I already put that on the list. I need lipoic acid. Well, that increases glutathione. Plus, it's necessary for the carbohydrates to go into the energy cycle. Same thing with the protein. You need your B vitamins. So it's like, So this test is also available. It's once again, I don't work for US Biotech any longer, but I was an educator for them. And I love this graphic. So attribution to US Biotech on that. But you can order that through Vitalio. But once again, working with your healthcare provider is always the best because they can then walk you through all these different parts. But here's CoQ10, here's malate. We've all heard the term magnesium malate, but here's our CoQ10. So there's some just common themes, but you can actually identify whether it be through organic acid tests, NutraVal or Nutristat tests, NutraVal, Nutristat. You can actually see what am I low on. When I did the similar test to NutraVal for myself, it was like, okay, I came low on 3 things. I was low on B12. I could make that guess. I was low in CoQ10. I always felt better when I took CoQ10. But the thing I had no clue about, and if you say, Chris, yes, Karen, what? And I would say, what was your third nutrient? I'll give you $1 million if you can guess it. I don't know. What is it? It was choline. Choline. So choline is the building block for acetylcholine, the memory neurotransmitter. So I asked my junior colleague, very bright lady, and she looked at me for wisdom, but I got wisdom from her that day. I says, Dr. Sarah, I said, what do you think would cause me to be low in choline? He says, Chris, how much stuff do you have in your head? How much stuff do you just stream to your patients like what we're doing right now all day long? How much do you have? Are you full out all day long? And do you think you're blowing through your choline in your memory neurotransmitter? Yeah. And so she had that wisdom. Why do you think you're low in choline? Like all of us. But now what happens if we're not assimilating and we're not absorbing, our GI tract's not so good, our diet doesn't have enough choline onto our body? And it's like, kind of interesting. And this gives us a little snapshot of a neurotransmitter component. And there's also standalone neurotransmitters. So we know when we perseverate, we need to support our GABA levels, and we need to support our serotonin levels. If we're overexcited and too stimmed, maybe we have too much epinephrine, too much norepinephrine, or sadly enough, anxiety, depression are often fueled by neuroinflammation. So is autism. So is attention deficit. So is Alzheimer's disease. Once again, the 3 A's.
Right.
And so with that said, we got to fuel ourselves to make our tissues, our organs, and our organism work better. So otherwise, and you're going to say, but my kid's not tired. Yeah, but is part of their brain that controls certain higher executive functions, or for us, because once again, we all probably are some degree of the spectrum, in my opinion. Are there certain parts of our body which are waxing and waning? And as I open up for the next question, because I want to be sensitive to time, I was giving a lecture to 300 or 400 medical doctors in New York. I flew in at 11 p.m. Eastern Standard Time. Once again, I'm the Oregon fellow. So, but I had a 7 a.m. keynote speech with several hundred doctors. Remember, I'm the guy that repeated the 4th grade, was told you're in special needs classes, this and that, until I was told my capacity was greater. And so I'm giving this lecture, and I said, before I started the talk, gift of gab again, as you've noted, Karen, and you have not noted it out loud, but I'm sure you've noticed, is I said, I'm going to talk about genetics and epigenetics. This was a decade ago, before it was all the rage to talk about genetics and epigenetics. I said, I'm going to tell you lots of things. The first I'm going to tell you as an audience is I'm tired. I says, it's 4 o'clock my time. My adrenal glands are still asleep. I flew in late last night, got to my room by midnight and fell asleep. And I said, and I had to do my hair for you. My hairdo is very similar, by the way. And I said, but let me ask a question to the audience. And I said, many of you had to travel to get here for this 7 o'clock morning lecture. How many cells in your body have to be tired before you feel tired? I said, anybody's welcome to answer. I said, or tell me afterwards if you're feeling bashful and or are really tired and aren't awake yet. And no answer. Then I said, how many, I'll make it easier question. I said, how many cells in my finger have to hurt before I said, ow, that hurts? No answer. I said, but is it 1 cell? Is it 1,000 cells? Is it 100 cells? Is it 1,000,000 cells? What is it? And then I finished with that before I started my lecture. I says, have you ever had a paper cut? And of course, everybody said, yeah. And have you ever had a bigger cut, like maybe cooking in the kitchen or working outside or something? Yeah. I said, sometimes the paper cut hurt more than the big cut? Yeah. I said, have you ever had a big splinter? Yeah. Have you ever had one of those tiny micro splinters that hurt like heck? Yeah. I says, how much do we not know about the human body, which is really the crux of our conversation. But we have to do what we can do at this point in time, knowing that in the future, our best might be better, but we need to work towards that. So we need to support ourselves, heal ourselves, and just like a cell phone, it has apps. Those apps are our DNA. But if we don't have the charge to run our software at the cellular level, all of our tissues, then we're not going to liberate our genetic potential. If we don't liberate our genetic potential at the energetic level, nothing's going to work. Our cerebral cortex, our cerebellum, our heart, our adrenals. So we need to remove that obstacle by treating the mitochondria as well. And so microbiome, mitochondria, the three little pigs, and nourishing our body. And so once again, doing a test like Nutristat, Nutraval, organic acid, see where we are dropping the baton on the relay race. So I am open for questions.
Well, okay. So what's the relationship between the mitochondria microbiome and the neurological function? Was that the answer to that question first?
Yes, to a large degree.
Yeah.
And so I gave a lecture in Las Vegas at the A4M conference, big conference that happens annually in December. Same time that the cowboy Christmas happens. The first time I went down there, I'm saying, why are all these people wearing cowboy hats on the airplane? I said, I'm from Oregon. I've traveled a lot from Oregon, but what's up with all these? And they have little cases for the cowboy hats. I learned lots of things about cowboys. And so I was giving this lecture about the microbiome and the mitochondria.
Right.
And so as a result, I learned many things about the mitochondria and the microbiome. One of the things I learned, though, was from a attendee. And he said, after my talk, because when we all give talks as speakers, people come and ask their personal questions or offer their insights. And he says, Chris, have you ever had a colonoscopy, endoscopy, a surgery, and then woke up on the other side and not felt so bright, not so awake anymore? I says, well, I had never thought of it. He says, and where he was way ahead of the curve. Once again, he was out of the box thinker. We now know that all those twilight meds, all those surgical interventions, like things like propofol, they all poison the mitochondrial pathways. And so, but my lecture was the M&M lecture, nothing to do with the rapper out of Detroit at 8 Mile. But my lecture was about the microbiome and the mitochondria, that they go hand in hand. And so taking care of the CoQ10, taking care of the carnitine, taking care of the lipoic acid, making sure that lovely little cycle works. But then if you and I were to take a nice little stroll, so you're done a remarkable job on the summit, you kind of take a breath, because I started before we started recording, I said, you're amazing, Karen. You do so much. I don't know how you as an Energizer Bunny keep on doing all these phenomenal things. Other than it, I know you have a big heart and a great brain, but now let's say we're done with the summit and we're going to take a stroll around a track, like a racetrack, a running track. And so, but lo and behold, they did not remove the hurdles from the hurdle race. So we had to walk around a hurdle. We had to walk around a hurdle, but that same walk would have been much more peaceful, much simpler, much quicker if we removed the hurdles, which are the obstacles. And so that's why the low histamine diet, the food sensitivities, and once again, a simple finger prick, well, simple until you poke your kid's finger, and then it's not so simple. But it's just, get some drops of blood. You can say, okay, well, these foods unique to her or him or them are actually problematic for them. I found out right before that lecture I gave on the M&M lecture, my wife had made a wonderful meal. And so she had made guacamole, some corn chips, non-GMO and organic. And she had cut up kiwi, and she found somewhere or another yellow and green kiwi. So I had yellow kiwi, and green guacamole, and yellow corn chips. And all of a sudden, my lips started burning, my lips started swelling, my tongue swelled, my face swelled even more than it normally is. And I had, for the first time, an anaphylactic reaction to something. And luckily, I had some Benadryl around. And it's like, wow. So all of a sudden, kiwi, I would argue, is fine for you. Avocado, loved it. Haven't had it since. Now I own an EpiPen as well. And so even things that we are told are good for you might not be good for you or your kid. And so that's why doing a test, food sensitivity test, measuring for pollutants, measuring for heavy metals. I have a little boy from Romania that has autism. He's nonverbal. He's 7, almost 8 years old now. But his dad always goes fishing. They're very down to earth folks, and they do a lot of hunting and gathering and farming and so forth. But they catch a lot of fish and salmon and so forth. But once again, which organic ocean, and let alone out of the Columbia River, which I swam in as a child, right when Hanford was dumping all their nuclear waste. So not only do I have a shiny head, but I may glow in the dark. There's rumors. And so then we want to look at DNA testing to look for unique differences for people. The omega fatty acid testing. This is just my to-do list. These are the low-lying fruits. And Dr. Kadish and I do a lot of this discussion also in our book. Stool testing. Once again, gut, brain, leaky gut, leaky brain. And you want to know, is there inflammation in the gut? Because all of us have had upset or unhappy tummies before. Oh, yeah. We're not going to be in the best mood. We're not going to be able to be most functional. And so I guess sleep apnea test, once again, thing we can live the least amount of time without is oxygen. Mm-hmm. And think of the 3 little pigs. So the big bad wolf is the world around us, the things that have contributed to autism, whatever you want to call those things. We're all very familiar with the things we think are contributing to it. But I would just argue, if I was Dorothy, I would say, we're no longer in Kansas, Toto. Because I mean, it's no longer a safe environment. And if we were any other species, we would be on a watched or endangered list. So once again, 30 years ago, my children, 1 in 500 chance for autism. That's 1 in 36. Something's desperately wrong. And we need to look at that as a humanity. But once again, are we building? And all we can do is our best. That's why I tell all the moms, all the dads, all the providers I help educate, all you can do on a given day is your best. Today's best might be better or worse than tomorrow's best. As long as you're giving your best, that's all you can do. And of course, love those that we have in our lives that have the experience of autism and nurture them to the best of our ability. And thank you for everything you do, Karen.
Thank you so much, Chris. This is really interesting. I love your little diagram of the the wolf and the 3 little peas. That's great. Can you want to tell us a little bit about your book? Like, tell us, I know you told us a little bit, but I know people are going to be really anxious to find out.
Yeah. So it's been a labor of love for Dr. Kadish and myself. We go over everything about, do you have toxic things in your bedroom, in your house, in your kitchen? Yeah. We talk about vitamins, minerals, and nutrients that are essential to have. And once again, we're going to be offering a large volume of free books to the audience. And because it's all a passion play for us, because you help one pass it forward, And so if we can make an environment where we can thrive and not just survive, all the better. So Dr. Kadish has even practiced longer than I have. I practiced for 33 years. I was the dean at the Naturopathic University, started community clinics for the poor and underserved. And this will be my 19th book. Wow. And I write on things that are of passion to me. And we also lost a kid in between our 2 children. And, so fertility is something which, if someone wants to have it, but once again, planting, like I told you about my garden, in as organic a soil and as pristine an environment. So there's even pre-conception, but even post-conception things that we want to be looking at. But once again, we are what we eat. So the 3 little pigs, but also the more pristine we can make our environment, the better. So in my office here, I have 2 air filters going. I have an EMF reader. So I actually see, okay, well, how far do I need to be away from things? Strangely enough, my plugged in keyboard throws off as more EMF than my screen does. Wow. And you're like, okay, how far can I get without getting carpal tunnel?
That could
And
be it.
I guess I'll finish on detective work. Every mom and every dad's a detective. Okay,
Mhm.
what got them in a bad mood? I don't want them in a bad mood. That's just any kid. And or what didn't work well with my parenting interaction? What problems did I bring to the equation? Because I'm still learning, even with adult kids, what my challenges are. But my son was complaining of waking up with headaches, fuzziness. I noticed his mood wasn't very good. And he was about 16, 17 years old. And I actually took my EMF reader and I actually took it to his bedroom. I did the whole house. And his outlet at the head center of his bed, where he lays his head, was the hottest of all the EMFs in the whole house.
Wow.
So then what I did was I put some EMF screening cloths in front of it. It arced out of the outlet. It caught it on fire.
Wow.
So could you imagine what it was doing to his brain? Because we're all neurological.
Yeah.
We do an EEG. We get all the little things like we're measuring what our body's putting out. We do an EKG. We're not putting anything in on either case. We're actually just reading electrical connectivity. So just those little things and all the technology that we're surrounded with, it, the kids sit at the tables at restaurants with their devices in their faces. So it's kind of, the other day I saw a mom and dad that actually had the old school star in the star holes, square in the circle hole, square in the square hole. Well,
Oh.
good for them. They actually are entertaining the kids without technology.
Yeah, that's really important. Just to remember what the world's all about, kids playing with kids, interacting with other people, social engagement, all these things that we just don't see that much anymore.
Oh yeah.
Yeah.
And even as adults, here's my cell phone, which I had a long ways away from me. It's always on. No, it's always cellular is always off in my house.
Yeah.
Wireless is minimized to only enough. But you and I could be at a restaurant and I'm doing my phone, you're doing your phone. How about the human being in front of you?
Yeah.
Let engage in that humanity. And the other day I saw what appeared to be a single dad with maybe a 6 or 7 year old little boy, and the dad was just smiling and smiling. He had his phone up, kid just sitting there, and the dad was having a relationship with his phone while his little kid was that good time? Probably not in the kid's mind. Want to probably chat with their parent. So
yeah, that's right. Okay, well, it was so good to hear from you. You have so much wisdom, and I would love to have like this on a sheet where I could have it handy so I'd remember it, and you might have something like that in one of the books.
I'll make a little handout for the audience.
Yeah.
With the understanding it's not diagnosis or treatment, but it's just kind of the low line tick list.
Right.
And so like, wow, I didn't think about that. Or, I had that exposure and heavy metals. Maybe it was the metal mercury that your mom had that transferred, or maybe mom or dad were really big into eating fish, but maybe not from the best river. Or maybe like I ate tuna fish for 2 years before I became a naturopathic physician. I was in MD medical school. And then it's like, okay, well, I ate tuna fish every day of my life. Along with no judgment here, top ramen noodles and cheese whiz and a lot of soda pop. And I'm like, okay, well, for 2 years, I was building myself, I don't know, out of, a medley of yuck. I mean, I take little pigs had over what I was putting in my body. So
tuna fish in a can.
yeah, oh, I know. And it wasn't necessarily the best quality tuna fish. I mean, back then I didn't know, and I honestly didn't care. So I said, some of that tuna fish, it's medley tasting. I didn't know what medley tasting was, but now in retrospect, I'm like, okay, would I just drink the whole mercury thermometer there or something? Yeah. Okay, well, a delight. I applaud everybody that's attending the summit. And if anybody has wisdom they want to share with myself, Dr. Kadish, we're here because we're educators. We love educating. You're an educator. And we're all together going to make the world a better, healthier, happier, and safer place.
That's awesome. And I'd like to remind everybody that this is through Gatherly, our platform, and you can go make appointments with people throughout the virtual summit. So anyway, thank you so much, Dr. Chris. You're amazing as always.
Thanks for everything you do. Thanks for everything you do.
Okay. We'll talk to you later.
Okay.